My name is Beth Caver. This is my video presentation for the online RN to BSN program at Winston-Salem State University for the Nursing 2501 Assessment for Health Alterations class. Today I will instruct you on an assessment of the thorax and lungs. Before beginning my physical assessment, a focused health history is necessary in order to determine any predisposing factors that may make the patient susceptible to the many types of lung disorders. After completion of the health history, I will take the patient's vital signs before conducting my focused examination of the thorax and lungs. Okay, can you come over here and sit down? I'm just going to ask you some questions. You can sit right there. Do you have a history of heart disease?
Not that I know of.
Do you ever have chest pain at rest or with activity?
No.
Do you smoke cigarettes?
Yes.
About how many cigarettes a day do you smoke?
I would say about 5.
About 5. Would you like to quit smoking?
Yes.
Okay. After we're done today, I'm going to give you some information on how to quit smoking.
Thank you, man.
Do you work in an environment that exposes you to any type of aerosol contaminants? Somewhere where there's asbestos, somewhere like a furniture packing plant,
No.
Anywhere where there's particles in the air?
I would say there is, but not harmful.
How do you know if they're harmful or not?
They don't affect me.
Okay. Well, it's important to know what your environment is whenever you're employed, because some of those places can affect your lung function as well. Do you have any breathing difficulties?
No.
How many pillows do you sleep on?
About 4.
And do you do that because you're short of breath when you sleep, or do you just like to be propped up?
I like to be comfortable.
Okay. Do you have asthma?
No.
Have you ever had a chronic cough or something called an upper respiratory infection where your lungs, like pneumonia, your lungs get congested? Okay. Do you have a condition called sleep apnea?
No.
Have you ever been diagnosed with COPD or emphysema? COPD means chronic obstructive pulmonary disease.
No.
Do you get short of breath with daily activities?
No, I wouldn't say that.
Okay. All right. Now I'm going to check your vital signs. That includes your heart rate, your blood pressure, your respirations, and we're not going to do your temperature today. Okay? I'll do that later. So I'm going to check your blood pressure. You can just put your arm in there. And just rest your arm down. Okay, your blood pressure is 120/65. That's good. Slip your arm out. Now I'm going to listen to your heart. I'm just going to count the beats. Or actually, I'll do it on your wrist. Here we go. So your resting heart rate is about 70 beats per minute. Now that the history and vital signs are complete, it's time for the physical assessment. Prior to conducting the assessment of the thorax and lungs, you should be familiar with the anatomy of this area. Let me sit down here. The thoracic cage is a bony structure with a conical shape that is narrower at the top. Sit straight up, please. It's defined by the sternum, 12 pairs of ribs, and the thoracic vertebrae, which will be viewed shortly. The diaphragm separates the thoracic cavity from the abdomen. I need to fix this so we can see you a little better. Slide over towards me. No, just slide over towards me. And then let's see if we can't do this. Okay, there, it's a little better. All right, landmarks on the anterior chest are the suprasternal notch, the sternum or breastbone, which is made up of the manubrium, body, and xiphoid process, the sternal angle, also known as the angle of Lewis, which is found at the second rib, and the costal angle, where the right and left costal margins meet at the xiphoid process. This is the angle right here. The mediastinum is the middle of the thoracic cavity, and it contains the esophagus, trachea, heart, and great vessels. The right and left pleural cavities are on either side of the mediastinum and contain the lungs. Now I'm going to have you turn around because I need to examine your back first. So just turn all the way around. Thank you. And then slide a little bit towards me. And then sit, okay, just like that. And sit straight up, please. Just sit straight up. Landmarks on the posterior chest are the vertebrae prominence of C7. It should be right about here. The spinous process of T3, the inferior border of the scapula, and the 12th rib. Initially, I would assess the posterior chest wall. The spine should be straight, and the neck and trapezius muscles should be well developed. Observe the patient taking a normal respiration. Just take a deep breath in and out. As well as assessing the skin for color and condition. Confirm symmetrical chest expansion by placing your hands on the posterolateral chest wall with your thumbs at T9 or T10 and have the patient take a deep breath. Observe for symmetry as I showed. Okay, take a deep, deep breath. Good. Next, you want to assess for tactile fremitus. Fremitus is a palpable vibration, and it should be symmetrical in the assessment points. You're going to place your palm on the posterior chest wall and have the patient say 99. When I put my hand on your back, I'll tell you when and you say 99. Okay, go ahead.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, you can just breathe normally. Next, you want to palpate the entire chest wall. Palpation will allow you to note any areas of tenderness, changes in skin temperature, detect lumps or masses, and observe any skin lesions. I'm just palpating now. Next, it is time to auscultate the posterior chest wall to determine the presence and quality of normal breath sounds. Have the patient lean slightly forward, cross their arms on their lap, and take easy breaths in and out through their mouth. Monitor the patient for dizziness during the assessment. Breath sounds are auscultated from C7 to T10 and from the axilla to the 8th rib. In all, you should auscultate approximately 18 assessment points on the posterior chest wall. So what I'm going to do is ask you to take easy breaths in and out through your mouth, and if you start to get dizzy, you let me know, okay? You ready? You doing okay?
Yes.
Sorry. Okay. Just breathe normally. When you're listening to lung sounds, it is important to note any adventitious sounds, such as crackles or rails, which could indicate fluid in the lungs, or rhonchi or wheezes, which can indicate tracheobronchial narrowing due to congestion or constriction. Next, it is time to assess the anterior chest wall. Have the patient turn around. So come around. Okay, thank you. I'm going to readjust this a little bit so we can see your chest wall a little better. Okay. Note the configuration and shape of the chest wall. Assess the costal angle as well as the patient's tolerance of the exam. Are you doing all right so far?
Yeah.
Any dizziness?
No.
Okay. Look at the skin color and condition. Check the lips and nail beds for any cyanosis. Your nail beds are nice and pink. Also assess the quality of respirations to make sure they are smooth and even without effort. Just take an easy breath in and out. Good. All right, great. Just breathe normal. Palpate the anterior chest and observe for chest expansion by placing your hands on the anterolateral wall. Have the patient take a deep breath and observe. Get right here. Take a deep breath. One more time. Okay, good. Just breathe normal. Next, you're going to assess for tactile fremitus by placing your palm on the anterior chest wall and having the patient say 99. Also observe the chest wall for any tenderness, masses, or skin lesions. All right, when I do this, I want you to say 99. Go ahead.
99. 99. 99. 99. 99. 99, 99, 99.
Okay, thank you. Almost done. Next, you want to percuss the interior chest wall and compare sides, just like you did on the posterior chest. Readjust this so we can see your wall. Am I hurting you? Okay. Now it's time to auscultate the anterior chest. Listen to breath sounds from the supraclavicular to the 6th rib. Evaluate each breath sound and compare. Just adjust this a little bit. Okay. Again, it's just going to be easy breaths in and out through your mouth. In. And one more time. And last one. Okay, thank you. You can get up. Thank you. This concludes the assessment of the thorax and lungs. Depending on your assessment findings, additional testing may be warranted to determine, such as pulmonary function tests to determine total lung capacity and possible airflow obstruction, pulse oximetry to measure arterial oxygen saturation, and observing the patient's respirations during a 6-minute walk. Thank you for viewing my physical assessment of the thorax and lungs.